Hey guys, what's up? So in this video what I want to do is just give a quick discussion on antidepressants, how they work to improve depressive symptoms, and some of my thoughts on just antidepressants in general. So one thing I want to start out by saying is, don't completely discount the utility of, medical intervention or pharmacological intervention when you are severely depressed. Because one of the things we have to really look at in all cases is that depression carries with it a really high risk of suicide. So, with that said, obviously the most important thing from a psychiatrist's perspective is safety and preventing any type of self harm. So, we don't want to completely discount the utility of these medications. If you have a depressed episode, you might want to try an antidepressant. Who knows? It might actually work. You may actually get a lot better than you are in your current situation, right? So it could be that your depression is related to things like life circumstances, right? Um, but we all know people, or we have all encountered people who are really depressed for seemingly no reason, right? They have a good life, they have a family, they have money, they have a good career, they have a great education. Everything on the surface, would seem that things are perfect in their life, and you would say, I wish my life were so great. But yet this person still remains depressed. So we have to kind of think about it from that perspective as well. Um, because these are the kind of people I feel like that end up falling through the cracks, right? These are the kind of people like, say, Chester Bennington from Lincoln Park, who, recently committed suicide. And again, here's a guy who was very, very talented. He had a lot of money. He had a nice family. He did struggle with addiction and things like that as well, and obviously depression. But on the surface, his life was pretty well put together. The other thing is that, people are reluctant to try medications. And I feel like, in particular, psychiatric patients or patients who are dealing with depression, anxiety, even psychosis such as schizophrenia or bipolar disorder where they have manic episodes, these patients tend to be kind of reluctant to use medication. And I think there's a lot of different reasons for that. Some people may feel as though medications are not the answer. They feel like maybe they can fix their own lives, or they should be able to fix their own lives without the help of these medications. But what I would say to that is that you have to look at other medical illnesses, right? Let's take, for example, something like diabetes, where a person has a deficiency of insulin or resistance to insulin, right? So a person who has a medical diagnosis like diabetes would, want to take, say, a drug like metformin, or if they're an insulin-dependent diabetic, type 1 diabetic, they would maybe want to also take their insulin, right? And we don't think anything is strange about that. They would also maybe implement dietary changes, lifestyle changes, exercise, try to lose weight, etc. But during that process, they would be taking their medication, hopefully, right? Because we want the best possible outcome for this person. But it tends to be with patients with depression, they, would rather just go in a different route. They'd rather explore alternative treatments through the use of dietary supplements. They'd rather look at other things like psychological interventions, which, I mean, there's nothing to say that these things are not good choices. However, again, giving an adequate trial of something like an antidepressant medication may really improve your life. And for the patients that I see the biggest improvement in, is the people who have a pretty well put together life, but maybe they still struggle with depression. So I'm not talking about, somebody necessarily whose life is a mess. I'm talking about somebody who has a fairly, good life. They're working, they have a job, they have a family. Things are really going pretty well for them for the most part, yet they keep having these recurrent episodes of depression. For someone like that, antidepressants is a really, really good choice. And of course, the other scenario too, where antidepressants I think would be really, really important, is in anybody who is suicidal, right? So anybody who's acutely suicidal because of their depression, then antidepressants would be a good choice there as well. And with a patient like that, you'd want to maybe start at a slightly higher dose, or maybe even titrate up a little more rapidly than you would with somebody who's just suffering from, like, say, mild to moderate depression. Obviously, there's caveats to all of these things, and there's technicalities, and it is based on an individual basis, but just in general, this is something that can kind of be thought about. So, with that said, obviously you can still do behavioral interventions as well. And my recommendation, my personal belief and philosophy when it comes to psychiatry, my personal philosophy when it comes to dealing with things like this, is that in general, you really should be doing both, right? You should be using pharmacological intervention initially to help alleviate some of the symptoms that may be preventing you from looking into or putting the necessary work into the behavioral interventions. Because one of the things that's really important for people to know, patients to know, is that it actually does require quite a bit of work to do these things, right? To make behavioral changes, to make changes in your life. It's not something that happens overnight. It's not something that happens without work. So people need to realize, and patients need to understand that this is very, very challenging, right? And it's even more challenging if you're already depressed. So that's where I think there can be some benefits there. Um, these are just a few of my thoughts on antidepressant medication, and in the next video I'm going to talk a little bit more about the technicalities of the medications, some of the side effects, and other things to be aware of when you're thinking about using these medications, have been using these medications, have been offered these medications. Um, I don't necessarily think we should never use these medications like I've talked about in this video, but there are other options and there are ways to use these medications in a kind of smart way that allows you to get through some of the more hard and challenging times. So I wish everybody a lot of luck out there. Anybody who's feeling depressed, I hope that things get better for you. I hope your life improves. I hope your circumstances improve. If you're interested in the channel, if you like the video, please subscribe. And I'll see you in the next video where we'll discuss a little bit more about antidepressants.